Hello, everybody. I am so excited for today's topic. I've been wanting to do an episode on PCOS for a while now because it is one of the biggest things that I see in women, especially if they're struggling with infertility, having issues with their menstrual cycle, problems with ovulation, weight gain, all the things. And we're going to get into the symptoms and things associated with PCOS. But let's first start with what is PCOS and what does this stand for, right? So PCOS is Polycystic Ovarian Syndrome. And if you break it down, poly meaning many, cystic meaning cysts on the ovaries, and then a syndrome included, which is typically like symptoms or patterns that we see in functional medicine when we're breaking this down. So Polycystic ovarian syndrome is probably one of the most common endocrine disorders in women that I see, and worldwide, like 10 to 15% of premenopausal women struggle with that. And if you think of that number, that's a really big number when it comes to endocrine disorders and what women are dealing with hormones, right? So it is one of the biggest drivers. It's one of the biggest causes of anovulatory cycles, which can lead to fertility problems with trying to get pregnant. So a lot of the times what I'll see is women coming, to us or even struggling with fertility, or they're having period problems. And a lot of these strange symptoms associated, it can be hard to unpack. So let's talk a little bit about how it's diagnosed in conventional medicine. In functional medicine, we definitely take all of this into consideration with diagnoses, but when it comes to patterns with PCOS, that's really what we're looking at, because you want to figure out what is driving this in me, right? Because these patterns and symptoms can be different for everybody. So it's really important to know that. So diagnosis criteria in the conventional world is with the Rotterdam method. And when it comes to the Rotterdam method, they're looking at a couple of factors when they're trying to diagnose PCOS. And what that is they're looking for high androgens or androgen type symptoms. And what do I mean by that? So high androgens could be anywhere from things like high testosterone, high DHEA, androgen metabolites like etiocalanolone and androstenedione. Even things like estrogen can be higher in PCOS. So they're looking at hormones that are higher or androgen type symptoms, which we're going to be getting into. So things like increased hair growth on face, acne, things like that. So they're looking at one or two of those, right? Do you have high androgens on blood work, or are you struggling really with just the symptoms of high androgens? And you can definitely see both or one of the other. The other thing they're looking at is either dysregulated cycles, which you could have a period 1 month, no period the next month, 2 or 3 periods a year. Your periods are all over the place, meaning your bleeds, right? So they're looking at that, or anovulatory cycles, because you can still bleed, but not ovulate. So this is where a lot of women will come, to the practice, or I have seen where they're cycling regularly, but they're not ovulating, or they don't have strong progesterone levels, or their progesterone levels are just really low, meaning they're not ovulating, right? So you can have dysregulated, cycles where your periods are all over the place, or you can have anovulatory cycles. Then the next thing that they look at is cysts on the ovaries. So these are those pearl-like fluid-filled cysts on the ovaries. And they're looking at many, not just like one cyst. They want to see like above 9. So you're looking at many cysts. And what they want is 2 out of the 3 criteria. So you don't have to have cysts on the ovaries, right, to have PCOS. If you're struggling with dysregulated cycles, anovulatory cycles, high androgens, or even the high androgen type symptoms, right? You can have 2 out of the 3. That's what they're looking for when it comes to diagnosis with this. So just keep all that in mind. Now, in functional medicine, we're looking at patterns. And when I'm diving into hormones and things with patients, so many symptoms and things overlap with different hormonal dysregulations. So I'm really trying to figure out, okay, what is driving this in patients? Because there's many different drivers of PCOS, and you can have a combination of drivers too. So before we get into the types of PCOS, let's dive into symptoms. So it's really hard on women, the symptoms with PCOS. And one of the big ones that I do see is hirsutism. Hirsutism is that increase in hair growth in unwanted areas. Now, when I'm talking about hair growth in unwanted areas, it's very normal for different ethnicities, depending on, where you come from, to have like darker hair above the lip, maybe more hair throughout the body. That can be normal for you. With polycystic ovarian syndrome, what we're looking for are those rogue hairs, right? Those similar to like underarm hair or pubic hair. It's those rogue hairs on the chin, the nipple area, the navel. So they're typically hard, they're rogue-like, and they're very coarse. So when women are struggling with PCOS and hirsutism is a symptom, it's very hard for those hairs, right, once they become rogue, to go back to their original state of soft and not even knowing that they're there, like peach-like fuzz, right? It's very hard for that to do that. So you can definitely stop the problem and the hair growth from getting worse, but I suggest if it's something that you struggle with and you struggle with PCOS, do laser plucking, waxing. That is your best bet when it comes to dealing with those rogue hairs. Yes, we can stop it from getting worse. You can really help those new hairs from becoming rogue, but definitely use laser. It can help. And hirsutism, it's awful for confidence, and it makes you feel so insecure. And it's heartbreaking for women who really struggle with this and they really want to get to the bottom of it, because some of these symptoms with PCOS, they're not something that you can necessarily cover up easily, right? It's for everyone to see, and it can really take a toll on your self-esteem. So just in my experience, laser plucking and things for those stubborn rogue hairs is what you want to do while you work on trying to make, new hair growth from not happening, right? Which is what you definitely can do. Hair growth with PCOS too, like those rogue hairs, hirsutism, it's very stubborn and it takes time. So be patient. So if you're starting to work on different things, like doing different things with herbs or working on blood sugar or decreasing inflammation in the body, give your body time, because it really does take time for those areas to really calm down and for hormones to regulate, right? Weight loss resistance is a big one with PCOS. And this is another very hard topic for any woman going through PCOS, because there's so many hormones involved. When hormones are really high and low, and we know all hormones are connected to one another, right? When one thing is off and in balance, it's going to impact something else. And when you're dealing with blood sugar dysregulation, high androgens, inflammation, the body is in such a stress state, it's going to have a really hard time letting go of any weight. So definitely stay the course. We're going to be talking about some action steps here if PCOS is something that that you struggle with, or you may be thinking, do I deal with this, right? We're going to get into all of that, but weight loss resistance is one of the biggest symptoms that I do see with PCOS, and it's tough. It really is tough, you guys. So the good news is when you stay the course and you really learn how to make your body feel as safe as possible, weight loss can happen with PCOS. It really can. We just need to figure out, okay, what is driving this in your body so you know how to best support it, right? So weight loss resistant cystic acne, this is another one that takes a huge toll on confidence with women. And the reason why, cystic is because of those high androgens, high testosterone, high DHEA, blood sugar dysregulation, even nutrient deficiencies along with hormonal dysregulation can really impact the severity of acne, inflammation in the gut, right? There's so many things involved that can make acne worse. Diet, we got to really watch diet with PCOS, and we'll get into that. But cystic acne is very, very hard, and it's one of the common symptoms that I see with polycystic ovarian syndrome. Dysregulated cycles, fatigue. Fatigue is another thing. When you're dealing with a lot of endocrine imbalances when it comes to sex and adrenal hormones, it's tiring on the body, and you will feel that. So and this is where we see this really big, loop with patients of being in this cycle of, I want to lose weight. I'm trying to work out even harder to lose weight, which makes you more tired. You don't have any energy to want to expend anywhere else, right? To try to help your body. It's a vicious cycle when it comes to that stubborn weight gain and things with PCOS. And fatigue, when you're dealing with a lot of these hormonal dysregulations, is a big, big symptom. So give yourself grace as you go through this and really try to work on figuring out the root drivers of what is driving your PCOS patterns. Anger or short fuse and anxiety, guys, this is a big one, especially with high androgens. If as women, we're very, with testosterone levels, yes, we need healthy testosterone levels, but when these levels are at a very large dose, like right within the body, you're going to feel like you're crawling out of your skin. You're going to have a short fuse. You're going to anger easy. I will tell you, back in my health journey, when my testosterone was higher, I thought I was going to crawl out of my skin, and it was very different from who I am, right? And it can make you just like what is going on, right? With my body, I'm having an out of body experience. I feel like I'm short fused with my kids. I have no sex drive, even though the testosterone is high. Again, going back to all of the fatigue and the confidence issues with all the other symptoms associated. Again, it's like you're a hamster on a wheel, right? So just know that the short fuse, anger, anxiety, all of these are very big symptoms when it comes to PCOS and the hormones that are involved. Okay, so let's talk about the different types, or the different types of PCOS, common drivers, right? Insulin type PCOS is the most researched type PCOS out there. 60 to 75% of women with PCOS have high insulin, and 70 to 80% of these women do struggle with weight loss or find that they are more overweight, right? Really struggle in that area. Now, 20 to 30% are not overweight, though. It's called like the thin PCOS. It definitely can happen, and we see that often. So keep that in mind. But insulin type, PCOS is one of the biggest drivers, and one of the most common findings. Insulin, high insulin levels is one of the common, types of PCOS. And one thing to understand about the ovarian cell anatomy, we have these important cells in the ovary called our theca and granulosa cell. And our theca cells are on the outside, and they make androgens, and our granulosa cells are on the inside, and they make estrogen. Both the theca and granulosa cells on the ovary have insulin receptors. So as you can imagine, if you have a lot of insulin Okay, it's going to cause an increase in testosterone and possibly an increase in estrogen, because we have all of this, insulin going in, and they're attaching to those insulin receptors on that ovary, right? And so we can have a lot of extra testosterone and estrogen going into circulation, also from our fat tissues too, and our adrenal glands, which could be making the issue worse, not just coming from the ovaries. So you can imagine with high insulin, it's going to make those high androgen type symptoms way worse. That's why no matter what type of PCOS I may find a patient is going through, I'm going to want to really regulate blood sugar and work on insulin, because it's going to automatically drive down those androgen symptoms, right? So prolonged insulin too, like having high insulin for longer periods of time, really inhibits the maturation of that egg, so that those follicles that are fighting for that dominant follicle is where you can see, like when patients are dealing with high insulin, it can really affect them, how mature that follicle gets, and it can really impede on that whole process. So I'll even see, even low estrogen or anovulatory cycles with low progesterone with PCOS. So it's not always high estrogen or high testosterone. I'll also see low estrogen sometimes with low progesterone having anovulatory cycles, because that follicle, that dominant follicle, just never matured, fully. And so we're not ovulating. So it's a very common thing that you can see when it comes to insulin type, PCOS. So you definitely want to get all of that under control, right? Blood sugar is a big thing. And insulin type PCOS is definitely the number one research type of PCOS out there. It has the most research. So no matter what, though, no matter what hormone I'm working on, PCOS or not, blood sugar regulation is really, really important when it comes to regulating hormones. So when you're dealing with insulin type PCOS, some of the common things that you'll see is the hyperandrogenism, which is you'll see the high testosterone, high DHEA with DHEA metabolites or other androgen metabolites, sometimes high estrogen. You will see, both, high insulin will cause an increase in that testosterone and estrogen due to insulin resistance with the theca cells and the granulosa cells that we just talked about a little bit earlier. And then, of course, prolonged insulin can really cause anovulatory cycles, right? And can really impact that dominant follicle from maturing. So it's really, really important to get your blood sugar in check. The next type of PCOS, it's the second common type PCOS that's researched out there, and it's inflammatory PCOS. So whenever I'm working with PCOS in general, I am wanting to lower as much inflammation as possible, right? And when I talk about inflammation type PCOS, it's really about diving into the microbiome. There's a lot of new research now, guys, about how important the microbiome is to our metabolic health, but also how we are metabolizing our hormones. So diet is a crucial part for the microbiome. We know we need really good prebiotic rich foods to help feed the good bacteria. We really need lots of healthy fiber for healthy bowel movements. And then, of course, you really want to make sure you are diving in and making sure you're not dealing with any infections in the gut. Things like H. pylori, SIBO, candida, parasites, a lot of these infections, right, can really impact how we're metabolizing and getting rid of hormone through the bile and through the stool. So if we're struggling with infections in the gut, we're just not clearing out as efficiently as we could and as we can. And we're getting a lot of excess hormone in circulation, right? So you really want to make sure that you are supporting the microbiome. And inflammatory PCOS, there's a lot of research with how important the microbiome is to taking care of that, right? So definitely dive in and do some stool testing. There's so much information out there. I know if you're listening here, you probably have many podcasts that you listen to, and there can be a lot of information in excess, right? That can get overwhelming for you guys. And I know there's a lot on stool testing. I personally, Dr. Campbell too, we run stool testing on almost every patient because it's so important to see, okay, how is your intestinal health? What does your good bacteria look like? Are you dealing with any infections in the gut? Because it impacts really everything. It really does. And so I really encourage you to dive into your gut health. And we're going to talk about how you can do that here in a little bit. So some of the less researched, but it's definitely, I see it in practice, is adrenal type PCOS, post-birth control PCOS. So I will say this, and I can't tell you how many times Dr. Campbell and I stress this, but when it comes to all hormones or anything in the body, you really have to support trauma and stress in your life. And it's not that you can always take care and get rid of every little stress in your life. That's not what we're saying, but you definitely need to put the proper tools in place in order to, help your body process that stress better. And even though the adrenals may not be the most commonly researched type of PCOS out there, when your hormones are impacted, oftentimes the adrenals are involved. So no matter what type of PCOS I may feel you may be struggling with, or what could be potentially what is driving it more than the other, right? I am going to focus on the adrenal glands, just like I'm going to be focusing on and looking at all the hormones. I'm going to be diving into gut health. Functional medicine is about putting a lot of those pieces together because everything is involved. So it's not just like, okay, I have insulin type PCOS, I'm only going to focus on blood sugar. It really is about putting all the pieces together. And I'll kind of tie it all in together for you guys at the end here of how we really, actionable steps with what to look at and where to start, because it does get overwhelming. So adrenal PCOS is definitely a big, associated type pattern that I do see with PCOS, but the other two, inflammatory and insulin type, is definitely more researched. Post-birth control too. I don't see this that commonly in practice and throughout the years. Usually, when patients are coming off of birth control, it can really take time for that brain to ovary connection to happen again, right? And you can start to see a lot of dysregulations and weird things with hormones as the body is trying to regulate again. So you can see a lot of those PCOS type symptoms or patterns with post-birth control PCOS, but it's not something that I typically see with, even too with anovulatory cycles, or when patients just aren't cycling. You can see like patients coming off of birth control where they don't have a cycle for a very long period of time. Usually I'm seeing more of, anorexia or eating disorders or tons of trauma and stress causing that more often when it comes to like not having a cycle at all. So I just thought I would mention that because it is something that I do see. So those are the main types. Insulin type, where we got to really manage insulin and blood sugar. It's a big driver of PCOS because it impacts everything. Inflammatory PCOS, where you really want to dive into gut health. the adrenal component, and then sometimes that post-birth control PCOS. Those are the four most common. Some disorders that mimic PCOS, though, that you definitely want to look into is pregnancy, right? So if you're not having a cycle or not ovulating, and some women don't know that they're pregnant for quite a few months, their body feels the same. So you want to just, check a pregnancy, make sure you're not pregnant. Certain medications can really impact the adrenals, and how we ovulate and our cycles can really increase androgens in the body. So make sure you talk to your doctors about the medications. Prolactinomas are very common too, to really increase those androgen symptoms. And I do see a lot of prolactinomas. You want to definitely make sure you're talking to your doctor, checking prolactin levels, looking at the pituitary gland, things like that, because it is common. Thyroid dysregulations too. We see a lot of low thyroid with PCOS. And low thyroid will impact ovulation, impact everything, impact your blood sugar regulation. So any thyroid dysregulation can really make you feel a lot of the symptoms similar to PCOS. Non-classic adrenal hyperplasia, too, androgen secreting tumors, things like that you want to rule out and make sure that that's not what you're struggling with. If you think you have PCOS, you just want to rule those things out too, when you're talking with your doctors and things like that. So what do we do about all this, right? What is, if you may be feeling like, oh, okay, my doctors thought maybe PCOS, what do I do? How should I manage this? Yada, 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 right? So first and foremost, when someone comes to me, I'm going to want to dive in and check their hormones. So I recommend a Dutch test complete. And I will walk you through how you can do this too. But this is looking at your sex and adrenal hormones like estrogen, progesterone, testosterone, DHEA, and your metabolites, cortisol, how you are metabolizing your hormones. This is not just looking at your levels, but it's looking at how you are metabolizing and breaking your hormones down, which is a huge piece of the puzzle when it comes to looking at hormones. And when one hormone is dysregulated, typically another is involved, right? Our hormones are like a web. So you want to make sure that you are tackling that from that. You want to look at all the hormones, right? Not just one hormone. So I like the Dutch test. It's very comprehensive and it gives you a lot of information that you just simply can't get from blood work when checking these. Doing stool testing. We really love the GI map test through Diagnostic Solutions. We find it's very specific and we've worked with many throughout the years, but you want to make sure that you're not dealing with any infections in the gut, right? You really want to work on lowering inflammation. You want to make sure you're digesting your foods optimally. You're not dealing with any leaky gut. So that is definitely another test that I would dive into. Blood work. So looking at your thyroid function, looking at thyroid antibodies, not just looking at TSH and T4. You want to look at T3. You want to look at your free and total hormone. You want to look at thyroid antibodies, get the full picture. You can look at FSH, LH, prolactin, A1C, insulin, very important nutrients too for hormones like iron, B vitamins, vitamin D, which is important for the immune system, but also important for ovulation. And then of course, look at inflammation and other metabolic markers like triglycerides to HDL ratio. These are some things that I start looking at when someone comes to me and I'm thinking PCOS, or really I want to get a good understanding of what we need to be diving into and focusing on. And this gives me a bigger picture of what I need to be focusing on so I can put those pieces together. This is what is beautiful about functional medicine because everything is connected. And so getting all of those answers is really important. I do want to say that first and foremost, with testing, you have to make sure you are diving into a healthy, low inflammatory diet. So staying away from a lot of the inflammatory foods like industrial seed oils, making sure you are limiting gluten. There's a lot of information and opinions about gluten, and I use my experience and practice to guide me. My patients teach me, and I will tell you it is very inflammatory for most. So I definitely eliminate it with patients a lot. Inflammatory dairy. Not everybody needs to stay away from dairy for long periods of time. It's very dependent on the person and how your body responds. But, with PCOS, you definitely want to limit it, and you want to make sure it's not driving that inflammation or making your symptoms worse, especially with androgens and acne and blood sugar. You got to be careful with that one. Getting in lots of color, plants, fiber, low glycemic fruits, organ meats, nutrient dense meats. Your diet should be consisting of lots of color, complete protein sources, just really supporting it with that nutrient density, eating balanced meals, sitting down while you're eating in a non-stress state, chewing your food optimally. This is very important when you're struggling with any endocrine disorder. But with PCOS, you really want to eat balanced meals. You definitely can have carbs, but don't go too high carb, right? Choose the healthier carbs, and I'll kind of walk you through some of the ways in which we help patients and people with this all the time. But you definitely want to listen to your body, and if you are more insulin type PCOS, going more lower carb can be very beneficial. Stress and trauma is another thing that impacts our hormones. I will say more than most things, you guys. It is, and I know you're probably rolling your eyes because we talk about it so much on this podcast, but I will tell you, it is one of the biggest drivers. So really putting those proper tools in place to really help you manage that stress better, so that you can really process it better and just manage it overall better. It's important, and I can't stress it enough. Looking at your environment, right? Your environmental toxins, making sure the products that you're using are good. You're not, your house isn't filled with candles. Guys, we got to really limit the toxic fragrances. We got to watch what we're putting on our body with the parabens and what we're storing our food in. Definitely be careful of those kinds of things. You want to watch that. So when I'm working with PCOS, yes, the testing is very important so we can figure out what's driving it. But diet, stress, making sure that you are sleeping and taking sleep seriously. You hear that saying, sleep when I'm dead. No. And I'm telling you got to make sure that you are getting solid sleep and figuring out how you're sleeping and where you need to work on with that. Because if you're not sleeping, your hormones are being impacted. So these are some of those foundational tools that you really need to focus on when working with that. Okay. So also too, having joy in your life. These are some of those foundational things that we need to focus on. We live in a very busy, fast-paced world right now, and you got to find time for joy, for love, to spend time with the people that make you happy, that fill your cup. Even if it gives you joy to be by yourself. I get it. I love that myself. I need that me time because the type of job that I have, I really give, and I have to fill my cup back up. So it's important to really make sure you are getting in that joy. Social support, if you have that, and I understand we're all different, we come from different families and backgrounds and things like that, but asking for help if it's there, getting help or putting those proper tools in place so that you have that support, especially for moms. We take on so much, dads too. You guys take on the world to provide for your families and things like that. So asking for that social support is really important for hormones. And then circadian rhythm. This is a really important one. This is some of those foundational things making sure that you're getting full spectrum light exposure to your eyes, especially in the morning when that sun comes out. Even if it's not sunny, guys, really step outside, expose your eyes to full spectrum light. We spend so much time inside, stuck on computers with our jobs, and then we have all the artificial lighting inside the house. Then if you think about it, the sun goes down, then we're exposing ourselves to more blue light, which is impacting our circadian rhythm and really impacting our sleep cycles. So really put those proper tools in place. So when it comes to a lot of this, Dr. Campbell and I were really, really excited. Our functional medicine at home courses are live now, and we've had a lot of really great feedback. And so this is where you guys can start diving into testing. If you want to do a stool test, we can lead you there. You can run a stool test. We show you how to break down that stool test and how you need to support your body accordingly. Same with the Dutch test for men and women. We break a Dutch test down for you guys, show you how to support your body and the different protocols depending on what patterns you are going through. So definitely check out the functional medicine at home courses that we have available. We also have a core program, which is very foundational, okay? And this is where we want most patients to start, okay? Because this is teaching you how to eat, right? What to eat, how we start processing and helping stress and trauma in our life. Different things as far as the environment and how that's impacting us, really working on our gentle detox pathways, right? The core program is very, very foundational. We really like patients or people to start there, right? And then really dive into the thorough testing. Now, in the courses, the testing is not included. You definitely can buy the testing at discounted rates throughout the course, which is great. So what we recommend is going through the core program, ordering your testing, right, as you're starting to really work on the foundational aspects of health. And then once that testing comes in, you can dive into your gut health to figure out how to support your body. And we walk you through all that. And then, of course, diving into hormones. And this is important for everything that we just talked about with PCOS too. The Dutch test is absolutely amazing so that you can figure out where your hormones are at. If you're dealing with higher testosterone, there's things you can do to support that when it comes to support and different things, right? When it comes to the dysregulations that we find in there. If you're dealing with high estrogen, there's things you can do to support that, right? If you're dealing with gut infections, we show you how to get rid of that and how to support that. So definitely check out the Health Babes Functional Medicine at Home courses. One thing I will say, where you are going to get your most savings is in the bundle. So if you plan on diving into your health and really taking action, the bundle includes the core plus the GI map test breakdown with support, plus the Dutch test breakdown and support. So we walk you through all of that. You can find all of this at healthbabes.com/courses, where we kind of walk you through where you can see what is best for you. So we're really excited about it. We put our heart and soul into this, and it's where you can really dive into some of this amazing functional testing that we have. One thing that I wanted to talk to you guys a little bit first too, before we, wrap up here, is some of the common supplements and supports that you can even start researching right now that I've had excellent results with patients when working on PCOS. And you'll find a lot of this stuff in the courses too. So keep that in mind where we walk you through if this is what your body needs. So berberine's a really good blood sugar, insulin, triglyceride support. I find it really drives down that A1C, lowers triglycerides. It's very, very helpful for PCOS. Same with inositol. Inositol is another really great, it's a really great supplement to help support healthy ovulation. It really helps manage blood sugar. 5-alpha reductase inhibitors are really great too, like saw palmetto, white peony. There's a lot of different types of alpha reductase inhibitors, and I go into a lot of these in the Dutch breakdown and provide a lot of these for you guys. But this is where you will see if you favor more of those androgenic pathways on the Dutch test and where you need to support that, because there's so many great ones out there. It can just get a little bit overwhelming. So I've had great results with saw palmetto. Melatonin is really good liver support, like NAC is really good and really important. You definitely want to support that liver because, again, your liver is really responsible for so much of the breakdown of our hormones and metabolism. Liver is the master, there's so many important jobs of the liver. This is why we focus so heavily on babying the liver in the core program that we walk you through all of this. So I hope you guys enjoyed this episode. I know it's a lot of information to dive into. If you're someone that's really struggling with PCOS, definitely talk to your doctors about the different testing you can look at in blood work. We're going to be adding more to our courses where we're going to be diving more into blood work in the future and things like that. There's so much that we want to share with you guys, but definitely dive into the Dutch test, the gut test. Really get those foundational tools aligned for yourself if you're struggling with PCOS or if you feel like this is what you struggle with, and get that in order. But thank you so much for listening. I hope you guys have a great rest of your day.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on drbeckycampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Krystal Hohn. Have an amazing day.